Hi, Dr. Hall. Continuing on, we just finished talking about gonorrhea and chlamydia, and now we're going to talk a little bit about the epidemiology of those two infections. So epidemiology is the study of a disease in a population. So especially when it comes to infectious diseases, looking at how things are transmitted, how they're spread, what the statistics are, and potential measures to control those diseases. So one of the numbers that epidemiologists pay close attention to is what's called incidence. So the incidence of an illness is the rate of cases of that illness that get diagnosed within a certain period of time, usually a year. So it's how many positive tests for chlamydia did we have at Stout, for example, in the past year. That is incidence, and it gives you an idea of how many people are getting infected. The trouble with incidence, however, is it depends on people actually going in and getting tested and getting a diagnosis. As we talked about with chlamydia, oftentimes it's asymptomatic. So there could be people out there who have chlamydia but never got tested, and so they don't know it. Those folks wouldn't show up in measuring the incidence. So if we look at the data, we're going to see another artifact of the fact that it relies on who gets tested here. So this is data from 2014. These were annual cases per 100,000 people broken down by age. So there's lots of interesting things to see in this chart. First of all, on the right side, we have women, and on the left side, we have men, referring to biologic sex here. And what we can see is very high rates of diagnoses of chlamydia in young female-bodied people, right? So that 15 to 24 or 15 to 29 age group is where the majority of the cases are occurring. We can also see in the male-bodied folks, again, that same age range. As we've talked about before, community prevalence is important, and these things are more common in young people, young adults, and young adults are having sex with other young adults, and so that increases the risk of getting them, right? So if every 20-year-old was only having sex with 60-year-olds, things would be different. But so we see very high rates in young adults. But the other thing that you can't help but notice is look at how many more cases there are in the women, right? So we've got 3,000 versus 1,000. And so we say, well, why is that happening, right? Most of those women are probably catching it from the men. And I don't think all those men are just players and having multiple partners, and that the women aren't having multiple partners, right? We know that men and women are fairly similar in terms of number of sexual partners in your age group. So you have to think, okay, well, what are the factors that influence whether or not somebody's getting tested for these things? And in the case of chlamydia, where it's often asymptomatic, usually the only people getting tested are the people that are going to their doctors for routine medical care. And in the age group of young adults, the people who go to the doctor regularly are usually female-bodied people who are going to get prescriptions for birth control. And usually at those once-a-year visits for prescriptions for birth control, the doctor's going to say, or the nurse practitioner is going to say, hey, let's do a test for chlamydia. Let's just make sure that everything is fine and healthy. So what we see is a much higher incidence in females, but we would expect that, right? Because we're testing them much more frequently than we are testing the men. So if we look at our data from Stout over this past year, I don't have September, I don't have March, but if we look from month to month, we do a varying number of chlamydia tests, and every month, usually somewhere between 5 and 10% of them come back positive. So if we look over the course of this academic year, for the months I have listed, over 200 people were tested for chlamydia, 18 people were positive, so our positivity rate was 8.1%. Now, of course, that doesn't mean that 8.1% of all Stout students have chlamydia. It just means that 8% of those who came in and got tested. Now, so some of those people who came in and got tested maybe were just there for a routine visit for birth control. a good number of them probably were, but some of them probably also came in because they got a phone call from somebody saying, guess what? We were together 2 weeks ago and I just got diagnosed with chlamydia, so you should go in. Or they're coming in for a test because they're having urethritis symptoms. So these folks who got tested are not necessarily reflective of the general overall population at Stout. So if we just say, okay, well, maybe on average, we diagnose 3.5 students per month. So that would be 42 students over a calendar year. And then if you took that out of about 7,000 on-campus students, that would be an incidence of 0.6% of Stout students. But then that's going to be flawed too, because not all Stout students come to student health services to get tested. Even if they have symptoms or need routine care, sometimes they're going to a home doctor, or sometimes they don't have insurance, so they're just not getting health care, or sometimes they don't realize they should get tested on a regular basis. So not everybody is coming in and getting tested. So incidence is helpful, but an incomplete indicator of what's going on. So, right, it depends on who gets tested. So people with symptoms or who got one of those phone calls saying, hey, guess what, right? So have known exposure, they're more likely to get tested. And a lot of people with no symptoms won't get tested. And then it depends on your healthcare resources, right? What's your insurance coverage? Do you realize that this is something you maybe should be getting tested for? Does your insurance cover it? Is there a doctor nearby that you trust to go have this done? All of those things come together. So what we really would like to know is the prevalence. So the prevalence is number or proportion, of people who actually have the illness at any given time. So right now, at this moment, how many Stout students have chlamydia? Well, we don't know that. It would require us to randomly sample and test students to find out. And I assure you, I would like nothing better than to stand outside of like Price Commons or in the MSC and just test every single student that walks past me. I would love to be able to do that. There would be some logistical hurdles, right? But then that would give me a better idea of how many Stout students actually have chlamydia at this moment in time. But I can't do that. But luckily, the government does do this. So there are multiple different studies. There's one called the National Health and Nutrition Evaluation Survey, where literally government agents go out into communities, knock on people's door, say, hello, we're looking for various diseases in the population. May I swab your vagina? May I draw your blood, right? And they test for all kinds of things. They look at blood pressure and cholesterol levels and HIV and chlamydia and all kinds of things. So we actually do have some data. Of course, they don't test everybody in the country. They test a representative sample. So we do have some prevalence data at the national level. And what we find, and so this is by age, so on the left-hand side you have age 14 through 19, and on the right side age 20 to 29. And we have a couple of things here. So the gray bar is the last time they did that survey study, 1999 to 2002, and then the orange one is the most recent one, 2013 to 2016. And so when they went out and they knocked on doors and said, may I swab your vagina or your rectum or collect your urine, what they found is that in young people, back in 1999, 3.4% of 14 to 19-year-olds had chlamydia, and almost 6% now, most recently, have chlamydia. So that has gone up quite a bit. And for ages 20 to 29, the numbers are a little bit lower, but still going up. They were 2.5% almost 2 decades ago, and then recently they were up to 4.2%. So not only are we seeing that at any given moment about 4% of young people have chlamydia or more, right, if we include those teenagers, but those numbers seem to be going up in our country. So just a reminder here, so incidence is the number of positive tests in the population over a given period of time, usually a year, whereas prevalence is the number of people who have the infection at any given moment of time. So remember, we've talked, your risk for getting infection depends on not only what you do and how you do it, and who you partner with and how many partners you have, but also on the prevalence of that infection in your community. So that prevalence and the fact that chlamydia prevalence is going up is really important to know. We can also look at the importance of communities on the geographic level. So this is, unfortunately, this is incidence data, not prevalence data, but it can be somewhat suggestive. So you see we have some of the highest rates of diagnosed chlamydia in the southern United States. And up here in the northern Midwest, we seem to be faring relatively well, but perhaps it's because we have programs like the Family Planning Only services that allows people to get tested and treated for free, whereas a lot of other states do not have programs like that. When I looked at that map, I thought, gosh, it reminds me of something else, and it does. That map looks a lot like this map, which was of unintended pregnancy. And so I just wanted to kind of make the comment that, you know, in some ways, unintended pregnancy is an STI, right? It is a consequence of unprotected sex. I wouldn't necessarily view a fetus as an infection, but it is kind of a parasite in some ways, in some manners of thinking. But so oftentimes when you see more STIs, you also see more unintentional pregnancies because it's just reflecting that there is more unsafe sex happening. So our chlamydia incidence data has also been going up over time, right? But we would expect that because that's supported by the prevalence data, right? If all we had was incidence data, we just made, well, are we just testing more people for it, right? But our prevalence data tells us that yes, in fact, chlamydia is going up in our country over the last couple of decades. So what about gonorrhea? So gonorrhea, so we have numbers going back into the 1940s again, and look at that. Again, we see a bump in cases in the 1940s around the time of World War II, just like we saw with syphilis. And just like we saw with syphilis, guess what? Penicillin treats gonorrhea. So once penicillin came on the scene, gonorrhea cases went down significantly. And then we look at the late 60s, early 70s, and we're like, what is happening here? Well, the summer of love was happening here, right? And American society was changing drastically. Also, the birth control pill had now been invented and was available. So now people had a little bit less motivation perhaps to use condoms because they could be on the pill to prevent pregnancy. So huge increase in cases in the 70s. And then we see kind of a little bit of a bump where it starts to come down, so people are kind of getting the word, and then right here it comes up a little bit. What's happening there? Well, that's when actually we started to see some resistance to the antibiotics in gonorrhea developing. So we kind of got a bit of a handle on that, which helped somewhat. But then what really made the rates, the incidence of gonorrhea drop precipitously in the early 90s, you might remember, would be HIV came on the scene. And so people got much more serious about decreasing their risks and practicing safer sex. If we look at incidence by age and sex, this looks a little different than chlamydia. It looks the same in terms of the younger age groups having the most numbers of cases, but male and female is about the same for this one, which makes sense when you think about the fact that gonorrhea typically causes symptoms. So people who have gonorrhea, they usually don't walk around not knowing that they have it. They usually get some symptoms that tell them, oops, something is wrong, and they go in and they get tested and they get treated. Because gonorrhea is usually symptomatic, except for when it's rectal, remember, the prevalence is also lower because people get diagnosed and they get treated rather than kind of wandering around and continuing to have unprotected sex with lots of other people and spreading it. So as soon as pretty soon after getting infected, people realize something's up, they get it taken care of, and therefore they're much less likely to spread it to others, right? As we see in the case of lots of different infectious diseases, if asymptomatic spread is possible, that tends to make the infection much more widespread. So gonorrhea is much less common. The overall prevalence is 0.24%, right? So compare that to chlamydia at over 4%. More than an order of magnitude different. What about over time? So I kind of showed you that historical graph, but we are also seeing, similar to chlamydia, some increases here in the rates of gonorrhea diagnoses, predominantly in men at this point. So our work is not done. I also want to point out, so this slide is kind of busy, there's a lot going on here, but I want to point out how different sub-communities relate to each other. So we've talked about geographical communities, we've talked about communities according to your sexuality, right? So this particular graph is looking at 3 different categories of people. So the gray bar is men who have sex with men, either exclusively or who are bisexual and have both male and female partners. The dark blue bar is men who have sex with women only and never have sex with men. And then the light blue bar is women, regardless of what types of partners they have sex with. And so what we see here is that in San Francisco, this is looking at the proportion of cases of gonorrhea as to how people identify. And more than 80% of all of the diagnosed gonorrhea in San Francisco is in men who have sex with men. So obviously, if you live in San Francisco and you're a man who has sex with other men, this is an infection you need to be thinking about. Interestingly, however, if you look over here in Virginia, right, most of the cases of gonorrhea are in men who have sex with women only. In fact, in most of the rest of these areas, maybe just to here, right? It is more common in people who are having heterosexual sex than in gay men, so to speak. So all of these factors come together, and it's very regional as well, right? Because that determines what's the likelihood that you're going to run into this particular infection. So this is the first time we've talked specifically about men who have sex with men as a group. And so they do tend to have a higher prevalence of many of the STIs within their population, which then means they're at higher risk of getting the infection, which then means even higher prevalence, right? So once something is more prevalent or more common in your community, it's likely to stay really common in your community. When we think about men who have sex with men as a group too, they also don't have that additional motivation of avoiding pregnancy to encourage condom use. So just like we saw with the Summer of Love and when birth control pills became available, people were less motivated to use condoms. We saw more STIs. So that can be another factor leading to the higher rate of these infections in this particular sub-community. Also, unfortunately, there's still a lot of stigma and discrimination against the LGBTQIA community still in our modern world. And so oftentimes people who are a gender or sexual minority are less likely to go to the doctor to access health care, or if they do go, they're less likely to give accurate sexual health information because they're worried about being discriminated against. And unfortunately, that's kind of they do still need to be worried, right? It's not necessarily overblown fear, depending on where you are and what the circumstances are, right? And as we talked about, it's important to test all sites, right? So if a male-bodied person goes in to get tested and doesn't inform the physician or the nurse practitioner that they have had anal receptive intercourse and they don't get a rectal swab, it's possible that they have an infection, but it didn't show up on their urine test, right? So sometimes then that can contribute to higher rates of infection in the community. So lots of factors involved there. So in summary, incidence is the number of positive tests in a period of time, and that depends on who's getting tested, which depends on how well educated the population is, how much access they have to healthcare. It also depends on whether the infection is typically symptomatic or not. Prevalence, however, is going out on knocking on the doors of a slice of the population and seeing what percentage of people on any given moment have this infection. So that's the number we really care about, but it's harder to get. Chlamydia is very common because it's often asymptomatic, which is the perfect recipe for being able to spread So prevalence is about 4% or 6%, recently in young adults. Gonorrhea is much less common because it's more likely to be symptomatic. So its prevalence is less than 0.5%. So in our final section on this lecture, we'll talk a little bit about public health and STIs.